Welcome to my channel. Now I'm going to show what are all books I used in the third year. In third year we have a ENT and ophthalmology, preventive medicine and forensic medicine. Okay. In ENT I use disease of ear, nose and throat and head and neck surgery. PL Thingra. The author is PL Thingra and Shruti Thingra and 8th edition. In the ENT we have disease of the ear and disease of nose and paranasal sinus and disease of pharynx and disease of oral cavity, salivary glands and disease of larynx and trachea and thyroid gland and disorder. But most of the questions are asked from the ear, nose, throat and not from the thyroid gland. And we have disease of esophagus, and we have a recent advanced technologies also, and it gives some surgeries and clinical methods in ENT and neck masses, and it also with 8com and other related topics. The Thingra is most useful book in the ENT, and it is attached with anatomy and disease and surgery related. And coming to the preventive and social medicine, we have I most preferred book is the Park textbook of preventive and social medicine. So it is the 27th edition. In this part we have the concept of health and disease and principal epidemiology is most important topic in the preventive and social medicine, and epidemiological methods also, and immunization schedule is most important, and the screening for the disease, and it contains communicable disease and non-communicable disease, and also with health programs in India and demography and family planning. And the most important topic is preventive medicine in obstetrics and pediatric and geriatrics, and also in mental health and communication for health education, health information, disaster management is important, and hospital waste management is most important. This book is good to read, and you should read like a newspaper, and repeatedly you have to read it, then only you can understand the concept of the each topics. If once read, you can understand everything, but revision is most important in the preventive and social medicine, and you have to remember all the programs, what are all the programs introduced in our India is most important, you have to remember. Okay, health program is important, and it contains nutrition and health also. And coming to next is ophthalmology. In comprehensive ophthalmology, it is competency based medical information curriculum in NMC curriculum. It is the 9th edition. The author is A.K. Kurana. It contains, if you once read, you can easily understand, but it mostly contains terminology related words only, so you have to Google it most of the time what the terms means. Okay, it contains anatomy and physiology of eye and refraction and optics also, and disease contains conjunctiva, cornea, sclera and lens, retina, and also it contains ocular pharmacology and systemic and community ophthalmology. That's it. You can easily complete within 7 days in university exam, but if you want to understand, you have to read it a repeated manner, then only you can understand. The glaucoma is most important question in university, you have to study it. And next, in community ophthalmology, blindness is national program for blind control. That's important here. And in ophthalmology you have a Parson book also. You can use it. That books also. The author is A.K. Khurana. And the next one is forensic medicine. The principle of forensic medicine and toxicology under the NMSc. The author is Rajesh Bardif, third edition. This book I used in third year, and it contains you can complete within 7 days, because it's you can, if you just read it, you can write the university exam also. Okay, first we are coming from the toxicology. You can easily remember everything if once read it. The toxicology is most important one. Most of the questions asked from the toxicology. So in here, general toxicology and medico-legal consideration toxicology, and the poison is important: corrosive poison, metallic poison, and organic poison. Animal bites also, and snake bites, scorpion bites, and agricultural poison also contain, and cardiac poison, food poisoning, asphyxia, and that's important here. And coming to the forensic medicine. In the forensic medicine, it contains legal procedure, then medical jurisprudence, and euthanasia. Biomedical waste management is important here also. We already seen in the Park book, social and preventive medicine. And forensic odontology is important in the practical manner. And the important question is DNA profiling, and death and changes after the death, and postmortem examination is important. And also it contains injury, the mechanical injury and types of the mechanical injuries, firearm injuries and regional injuries, road traffic accidents, and medico-legal importance in the injury. Asphyxia is important here, and as most of the questions from asphyxia, so you have to study. And also from sexual jurisprudence, sexual offense and perversions, okay, and pregnancy. MTP is most important in the forensic medicine and toxicology, and abortion also. And forensic psychiatry is important. And starvation is, you have, if once read it, you can easily remember what is starvation. And medical legal importance also. And human rights and torture is important. And that's it. If you didn't read anything from the starting the third year, if you have 1 month, you can easily complete the ear, nose, throat, forensic medicine, and social and preventive medicine, ophthalmology. And the next book is what I used is Vision. It's a forensic medicine and toxicology, third edition, Vision, but it's just a review book. Don't use, I didn't suggest you to study the Vision book, because it's just give a key points only, so there is no use if you study means. So always go from standard author book. Okay, last, in forensic medicine I use Rajesh Bardel book and Vision, but I didn't use. And for SPM, social and preventive medicine, I use Park. And for ENT, ear, nose, throat, I use PL Dhingra book. And for ophthalmology, I use A.K. Khurana. That's it. Thank you.